Mental health is a priority of the Ministry of Health and Wellness. Portfolio Minister Dr. Christopher Tufton says mental health interventions have become even more significant due to issues that have surfaced or might occur as a result of the COVID-19 pandemic.
Health and Wellness Minister Dr. Christopher Tufton says a lot of Jamaicans are struggling with elevated levels of anxiety, stress and depression. His comments were made at the latest COVID-19 virtual conversations. It preceded World Mental Health Day, observed on October 10.
What is also emerging from our mental health teams on the ground is that conditions such as acute psychosis, adjustment disorders, post-traumatic stress disorder, and protracted grief reactions appear to be on the rise. In addition, we have detected, courtesy of the platform afforded by the Ministry of Health and Wellness and the mental health page, which I would like to promote, www.moh.gov.jm/mental health stories, that a number of Jamaicans are actually struggling with depression during this period.
He says the ministry has committed $20 million towards implementation of mental health strategies. In fact, the Health Ministry recently launched its COVID-19 Mental Health Response Program, which will provide community-based support through volunteers, professionals, and ease of access to mental health services.
They will be trained to help to create a sense of belonging and to provide some comfort to those who are in their communities who are suffering because of the isolation associated with the COVID restrictions. We will also have a mass media campaign to promote mental health and the prevention of mental illness. So the program will focus on increasing the skill sets of our healthcare workers and community volunteers. So our psychological first aid will be boosted, both to our mental health aides, but also to our community health aides, who we are recruiting and expanding currently.
Dr. Tufton says the intervention is particularly important for elderly persons, many of whom now spend most of their time indoors, given their vulnerability to COVID-19, and are struggling with feelings of isolation.
So our older persons are taking the COVID-19 threat seriously, based on this study, and are doing what is required to stay safe. Approximately a fifth think the guidelines, however, are difficult to do and impossible to continue with for a prolonged period, while some 34% report facing a lack of loneliness, feeling left out, feeling isolated. It is the lack of companionship and the feeling of isolation that we're seeking to counter, at least in part through the work of this mental health program that we're putting in place.
At the same time, he says children and youth are also facing psychosocial challenges due to the pandemic, which has kept them away from friends while moving them into a world where teaching and learning have to take place online.
Preliminary findings from a recent study by public health and aging expert, Professor Eldemar Shearer, provides us with some very important insight. Professor Shearer, who was on our COVID conversations last week when we were live from Mandeville, did a sample size assessment of some 228 persons aged 65 years and older. And the majority of them, with the majority of them being female, some 74%. Among the things she found, which confirms our concern and our conclusion, is that 89% of our older persons are leaving home less than before the first stay-at-home order in March. 22% reported canceling a doctor's visit or other healthcare appointments. Only 20% reported in-person visit with relatives, which means that even their loved ones are no longer visiting them, and out of a genuine fear that they may be transporting the virus to them in their setting. But the inadvertent consequence of not visiting is the loneliness, the depression, and other negative impact. And 98% of that sample said they stayed in touch via the phone primarily.
Persons who require mental health support are urged to call the Mental Health Suicide Prevention Helpline at 888-NEW-LIFE. That's 888-639-5433. They're also encouraged to share their story via the Ministry of Health's page, www.moh.gov.jm/mental-health. World Mental Health Day was observed under the theme Mental Health for All, Greater Investment, Greater Access. Simone Absalom for the news on PBCJ.